Hi everybody, I'm Dr. Jamie and I'm going to show you a great exercise that I call the postural lift. It'll take just 1 to 2 minutes a day to learn this, and then eventually you'll be able to do it all the time. It's done standing, so once you get the hang of it, you just do it whenever you're standing. So gravity is always compressing us, and we tend in our culture to have kind of sloppy posture, and we mirror that to each other. We tend to relax, we let our bellies drop down, our low backs will arch, our butt sticks out, and our head goes forward, and I'll show you exactly what that looks like. Belly drops, butt sticks out, head goes forward, shoulders round in, and that is like a large percentage of the population's posture. So this exercise is 2 parts to strengthen that. The first thing you need to do is a standing pelvic tilt. And a standing pelvic tilt is basically this part, which is the upper part of your pelvis, just tilting back. And that's done with these lower postural muscles. You'll pull them in nice and tight. And if this doesn't happen for you right away, just have the intention and keep at it, because eventually it will work, because we're meant to do this. So you'll notice when I pull in that that curve flattens in my lower spine right here. And that's great, because when I'm excessively curved, here it is, I'm actually squishing my spine together and compressing everything in my lumbar, and that's a huge cause of low back pain. So when you do this, it will help with that. So we're going to pull in, we're going to pull in, pull in, pull in, and when you pull in, you're going to notice that your weight starts to come back. It comes off the forward part of your feet into the back part of your feet. You'll notice that even just with this part of it, the shoulders will come back and the head will come back over the shoulders. Then the second part of this is you're going to separate, or try to separate, each of your lumbar vertebrae and then pull that all the way up through your whole spine by lifting each vertebrae away from each other. I often tell people, close your eyes and just imagine doing this and have the intention. So I'm going to start at the lower lumbar area. I'm going to start lifting. I'm lifting, lifting, lifting. Make sure to keep breathing. Make sure to relax your shoulders. My hand level is just showing you about where I'm at, what level. Right there, I naturally took a deep breath, which always happens with this exercise, because at that point my diaphragm can expand naturally. And so you'll get more oxygen. And then I keep going, lifting up through the top of the shoulders, and then through the neck area, and then finish off by a little bit of a pull from the crown of the head up. And then just check your breathing, make sure that you are, and relax the shoulders, and you'll notice I'm in great posture. I don't have any more curve, my shoulders are now back, and my head's tucked in over my shoulders where it belongs. So you want to hold that posture for about 2 minutes. If all you can do is 30 seconds, that's fine, and just do it a little bit every day. And like I said, eventually when you're really good at it, you can do it when you're standing in the grocery line or when you're talking to people. So to troubleshoot a couple of things that you might feel or notice you have difficulty with, one is that sense of separating or lifting. A great way to help that along is to imagine your feet pushing into the floor, or to imagine taking a deep breath. When we take a really deep breath and we expand our lungs and move it through our abdominals, you'll feel a lift that happens. And so that's the same lift we're going for. So just to give you an image of that and an idea of how to do it. If you have any questions, you know where to reach me. Please leave comments and subscribe to my channel, and thank you.